This recording is serving as the initial training session for the St. Ambrose University Interprofessional Health Clinic. Students and faculty involved in this clinic should be watching this video prior to doing any patient care within the clinic. Speaking on behalf of all the faculty, staff, and students who have been involved in designing this clinic and starting this clinic, we are very excited about this. This is something that's totally brand new within our college. We're building upon some of the clinics that we already have with the Scottish Rite Speech Clinic and the Occupational Therapy Assistive Technology House known as Jim's Place. We do have some health clinics, some community outreach already within our college, but this is something new where the different professions are coming together, and we're excited about all the learning opportunities that are available within our clinic. And I can tell you, we're starting off very small to begin with. We're open a half a day a week right now for the rehab clinic and a half a day a week for the medical clinic. We know that as our clinic becomes more and more successful, there will be more and more need, more and more desire from the community, but also from our students to be involved in this learning experience. And we're confident that this clinic will grow as the years go on. And in 5 or 10 years from now, we'll look back at this year or two and say, look at all the progress we've made and look at all the new things that have been happening because of this clinic. So we're excited to have you involved in this first year or two of the clinic. At the time of this recording, we're less than a year into our first year of being open and seeing patients. And I can tell you, just from the first few months of being open, we've learned a lot. We've changed things based on what we've learned, and there's been mistakes and there's been little revisions as we go. And I can guarantee you, as you go through this experience and as you see patients and as you work through some of the struggles of interprofessional care and running a clinic out of an academic program, out of an academic building, we're going to make mistakes and we're going to learn from those mistakes and move forward and make the clinic stronger. And there are definitely challenges to this clinic. We are being run by students who are still learning the profession of their study. We have faculty overseeing them from multiple different disciplines. We are working within a certain time frame, within a certain limited amount of space. This is not the most ideal way to maybe manage some of our patients, but we are providing a very good service from a learning standpoint, but also, maybe more importantly, we're providing a good service to those in the community that come see us. We will have challenges as we go, and I can tell you we'll grow and learn from each and every one of those challenges. And the challenges that happen are really part of the learning experience. The things you will experience will make you a better healthcare provider in the future. You already know what it's like to work through difficult decisions and difficult conversations with other healthcare professionals. You already know what it's like to try to manage a patient across all these different disciplines. You will have experienced that feeling that if only this patient would want to work on this with me, I knew I could get him or her better. Whereas the patient that may not be the patient's goal, and they want to work on something else with a different profession. All this is part of your learning experience and will make you a better healthcare provider in the future. The key to this whole clinic working is good communication. You have to communicate well with your fellow classmates, your fellow students. You have to communicate well with the faculty, both within your department and from outside your department. And we have to work together and collaborate. We do not have a clinic where PT sees a patient, then OT, then speech, then nursing, then PA. We work together as a team, and that's going to be the foundation of what makes our clinic unique and what makes our clinic so special. And the key is that we're there for each other, that we support each other. When we get stuck, we help each other out. When we get confused, when we don't know where to go next, we support each other and back each other up. And that's what's going to make the clinic work and be so successful. We are excited to have you in the clinic. Hopefully you're excited to take this next step forward and be involved in the clinic. It will be work, but I tell you it's worth the work, and you'll definitely learn a lot from being involved. So let's go ahead and get started with some of the basic training issues that go along with being in the clinic. There are a couple issues I'm going to discuss through this recording, but then other issues you'll have to go to a different recording to learn about. The first has to do with HIPAA. Now we do have a whole HIPAA manual which is posted on Blackboard under the Health Clinic Blackboard site, and you should have received access to that when you were assigned to be in the clinic. If you have not received access, you can reach out to Mike Putoff and he can get you access to the Blackboard site. You should take some time and read through the whole manual, and obviously we won't do the whole manual through this recording, but do take some time and read through the manual. The forms that you'll be signing off on are assuming that, or you're stating actually that you have read the manual and you understand the manual. So before seeing any patients, there's two forms you need to fill out. First, the confidentiality statement. Again, this can be found on Blackboard. And the other one would be the confidentiality agreement. And you can't read all the words maybe on this recording, but you see there's a range of things that you're agreeing to and you're stating that you understand. All of you have received some sort of HIPAA training through your individual programs. Thus, we're not going to spend the time in this recording or other ways to explain HIPAA to you again. But if you do have questions, please reach out to the faculty member within your department who is working in the clinic. The next is infection control and bloodborne pathogen issues. Again, you've received training within your individual program about infection control, about standard precautions. We're not going to, universal precautions, we're not going to spend the time to address this in this recording. But a couple things to keep in mind. Wash your hands, obviously, before and after seeing all the patients. Within the lab, we do have cleaning supplies for equipment and cleaning supplies for mat tables. If you're sick, don't come to the clinic. If your patient appears to be sick, we have masks for them to wear to prevent the spread of any kind of viruses or infections that might be present. We need to use our best judgment when we're working with our patients in these situations, just like you would in the clinical setting. So please refer back to the previous training you have had in your program about infection control and bloodborne pathogens. But do know, again, stress hand washing within the clinic, stress cleaning the equipment, cleaning the mat tables after use, and being aware of anything that we might have going on or patients might have going on to prevent the passing of illnesses. Building off the idea of HIPAA and communication, please remember that we should not be discussing patients in a way that they can be identified outside the clinic. So is it okay to go talk to your professor about a patient you've had and that professor is not involved in the clinic? For sure. If you want some advice from your one professor who has a little bit more expertise than maybe the one that was in the clinic that night with you for that patient who came in, feel free to go talk to that professor. You want to avoid using the patient's name or sharing information that would identify the patient. Can you talk about patients with your classmates? Yes, with a qualifier that, again, that you're not sharing information about the patient that allows the patient to be identified. Please understand that your classmates will be in the building most likely, and they'll see these patients coming and going, and they might be tempted to ask you and say, hey, I saw that patient walk in the clinic the other day. They look pretty interesting based on how they appeared or how they walked into the clinic. What was going on with that person? Well, that's not information you can share. So please be respectful of your patient's information, and I think if you explain that to your classmates, they will understand that too. We should not be using personal email or St. Ambrose University email to communicate about patients' names or any kind of identifying information. We will use St. Ambrose email to let you know if the clinic is going to be open or closed, if we have a patient cancellation or there's no patients for the day. We would email you and say there's no clinic today or the clinic is canceled for today. But any kind of communications about the patient should be done within the iSalus EMR system, and I'll show you that in a different recording. iSalus is our EMR system that we use, electronic medical record system. There are a few other recordings that you need to watch that go along with the clinic. So you can watch those recordings, and those will teach you how to use iSalus, at least to a level you can start in the clinic. We also have something called Physio Tools. This is an online exercise prescription program. So you can get in, you can log in information about a patient, you can put their information into the system, you can email them the information, you can progress the exercises, a lot of things you can do with this Physio Tools program. Now the one caveat to this is we have limited licenses, so we can only currently have one person logged in at a time into the Physio Tools program. If you have not received your login information, please contact Mike Putoff and he will get you logged in and go from there. So this concludes the training for the health clinic, at least the introduction for it. Please refer to the other recordings about iSalus and the Physio Tools to give you training with that. Thanks again for your willingness to be a part of this clinic, and I think you'll find this to be a wonderful experience.